Now to officially start our meeting, we'll start the Pledge of Allegiance. Commissioner Batchelor, would you lead us, please?
Thank you. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First item we have on the meeting this morning is we have reports this morning before we go ahead and approve any of the other minutes from prior. We should have Julian Nesbitt with us this morning from the Health Department. Julian,
not on yet.
She's not on yet?
Hold just a minute.
Okay.
Or you can move on with the agenda.
I'll move on to item B, approval of regular session minutes of 3/8/2021. Board, we've had these minutes in advance for your review and corrections. Is there a motion to approve?
So moved.
Is there a second?
I will second.
Any discussion? Hearing none, call the roll, please.
Commissioner Painter,
Yes.
Commissioner Batchelor.
Yes.
Commissioner Corcoran.
Yes. Our second item, then, we'll wait on Julianne to get on today, is the Little Fork Advocacy Center. Scott O'Reilly, and you are on to present this morning. Could your group present, please?
Yeah, thank you very much for allowing us to speak to you all for a few minutes. I know Commissioner Painter was on the board several years back when we first approached everyone in the community, kind of let them know how we started and where we were going. And this gives us a chance to update not only you as the commissioners, but really the community at large. I wanted to introduce a few individuals who are here to speak on Little Fork's behalf as well. We have Scott Robertson, who is the first board chairman of Little Fork. He is also the chairman of the RCF group. He has been on so many philanthropic boards, I can't even begin to list them all, but I certainly encourage you all to look him up. And we are very lucky to have him leading Little Fork into what's going to be a very exciting and worthwhile future for the east side of Cincinnati. We also have board member Mike Green, who was formerly the president and CEO of Delta Private Jets. He retired from that position in 2011. He also served as executive chairman of the Miller Valentine Group, having retired from that position as well. Currently, and I think this is what's so interesting about Mr. Green, is that he has been a police officer here in Clermont County since 2012. He currently is stationed as a detective, working on a lot of sex cases with the Clermont County Sheriff's Department. So he is well versed in what Little Fork's mission is, and he's seen it firsthand from the side of law enforcement. We also have with us Heidi Malone, who Commissioner Painter, you may remember this. She was with myself when we first presented this to the board. She's here to kind of give some updates from the Children's Hospital perspective and creating this satellite post of the Mayerson Center at Mercy Clermont, which is what I'm here to talk a little bit about, and then we'll pass along to the other speakers. And finally, we've got Erica Yingling, who is the United Way Director for Clermont and Brown County. She is also a board member of Little Fork and is going to talk about some of our prior successes and what we as a community can look forward to in the future. Obviously, those of you who are on the board might have remembered me as a prosecutor in Clermont County. I spent about 20 years of my career there, and I've now transitioned to a couple different roles, but the most important that I've now transitioned to is the executive director of Little Fork. Anyone who's talked to me knows that this is a passion of mine. I feel very strongly that we have to use a unified approach to addressing childhood trauma, childhood violence, and family violence on the whole. And that's what Little Fork stands for. And I think what separates us from a lot of other advocacy centers throughout the state of Ohio and really nationally is our level of collaboration. We have two separate hospital entities, Mercy and Cincinnati Children's, both individually collaborating with Little Fork. We have the YWCA, St. Joe's, Child Focus, CASA. All of those will be residential partners with us. And there are so many other organizations who routinely attend our meetings and collaborate with us on a regular basis, that they're very numerous. And obviously, if there's more time, I would go through all of them. What I wanted to update the board on as well is that obviously, like every other entity, COVID affected Little Fork. The last time we spoke, we had grandiose plans. We wanted to raise a significant amount of money and build a building. With COVID hitting us at the time it did, it completely derailed our plans. And if anybody who knows me or anybody who's listened to me, I've had a lot of people say that this will never be a reality. And I have put that aside every single turn. And so what I did is I reapproached Mercy Clermont, and they were receptive to opening space inside the hospital. And that's what we're doing. So we have our residential partners of Children's, the YWCA, St. Joe's, Child Focus, and CASA that will be operating our advocacy center out of Mercy Clermont. Obviously, this has significant benefits for law enforcement, CPS, and families in Clermont, Brown, Adams, and Highland counties, which is our direct service area. But on a larger scale, it really benefits Greater Cincinnati on the whole. And what we hope to do is be that beacon, be that model for other advocacy centers throughout the state and nationally. And I think this gives Clermont County the opportunity to really take a lead in this area. So with that, I want to turn my time over to Scott Robertson, give him a minute or two to talk to you all. Thank you very much.
Thank you, Scott. And thank you for allowing us to present to you today and to speak to you. As Scotty said, I'm still active in my businesses and active in the community, and I was not looking for another board to be on. When I met Scott O'Reilly and the team, it's so compelling. These people are engaged in groundbreaking opportunities for child advocacy. I just keep coming back to that word. It's so compelling. I could not say no. I wanted to be part of it. I'm humbled to be part of it because it's so amazing. And to really understand who these people are, these are the people you want in your proverbial foxhole. Do not deny them. They are very focused. Scott O'Reilly and his team will not be denied. It's an amazing opportunity in child advocacy, and I'm proud to be a part of it. And now I'd like to turn it over to Heidi Malone. Thank you.
Good morning. So I'm Heidi Malone. I've met some of you. I think we presented to you a couple of years ago about our original plan of Little Fork. And a lot of work has been done in the meantime to really have a physical space. Child advocacy centers are accredited through a national organization. And so once we're in our space, our multidisciplinary team will be working on accreditation through that national organization as well. From a children's hospital standpoint, we are going to provide the same services with the same staff. So forensic interviewing, forensic medical evaluation, we will be coming out to Little Fork to provide those services. So last night I was doing a little bit of research. National Children's Alliance does look at financial and customer satisfaction related to kids being seen in child advocacy centers. And their most recent research says that 95% of families that are served in a child advocacy center, that the advocacy center facilitates healing of trauma. And 97% of the multidisciplinary team members said that cases in a child advocacy center are much more efficient and effective than in communities without a child advocacy center. There's some older research that shows that cases that come through a child advocacy center save a lot of money. This was a 2006 research study, and I haven't seen that they updated it. But in 2006, they said an investigation of child abuse was about $1,500 less in cost through a child advocacy center versus being investigated just in the community without a child advocacy center. And then I think that when the focus is healing of patients and families long term, which if we can deal with trauma early in a patient's life, before they go on to not being healed from that trauma. So not being healed from trauma leads to long-term health problems. It leads to poor educational outcomes, which leads to poor employment outcomes. And all of those things, cost our communities millions of dollars. And so it's really important, the work of Little Fork to start that healing process as early as we possibly can. And so we're so happy at the Marison Center to be a part of it, to be asked to be a part of it. And really looking forward to our collaboration with Clermont County agencies and the commissioners. And I think I'm turning it over to Erica.
Yes, that's correct. Thank you, County Commissioners, for having us today. We're really thankful for the opportunity. I know most of you, but I just wanted to share a little bit about my involvement with Little Fork since 2013. In my past life, before I took on the role as a director of Clermont and Brown County at United Way Greater Cincinnati, I was a director at YWCA for Clermont, Brown, Adams, and Hamilton County. So working across those 4 county regions, and I know we've done many things together. From the county perspective, Domestic Violence Awareness Month, we had all of our victims' rights events in April. In addition, just some of the work that we've done to look at how we can fill gaps between people who are experiencing obstacles living in more rural communities that maybe weren't necessarily connected to Hamilton County or the services that Marison Center offers there. So what I've seen since the first time that I met Scott O'Reilly in 2013 was one, the ability for us to work together for the most effective outcome for families. I presented then 8 years ago at the Clermont County Sheriff's Office on a lethality assessment for domestic violence victims. The group was somewhat smaller than it is now. We probably had 10 or 12 people around the table, but it included law enforcement, our child welfare workers, and of course our governmental agencies, but all willing to learn and listen about how we could reduce the impact of trauma for families. So fast forward 8 years, we have met every other week. We have provided comprehensive case review when necessary and appropriate. We have had discussions in which we have found solutions for families that were the most impacted by trauma. So when you think about my work at the United Way from a macro level perspective and a funding perspective, we see how trauma impacts our communities. We see educational disenfranchisement. We see families who have substance use. We see our children entering into juvenile court. We see all of these things that can be connected back to that primary point of trauma. And this is why it is incredibly important for me, one as a participant, but a board member, to stand up here and say, this is something we need in Clermont County. Not only is it going to serve our own citizens, also provide outreach to those rural communities in which they find they have a transportation barrier. Some don't know where to go downtown. I mean, children's can be daunting, and that could really prohibit a child or a victim of trauma from receiving services. You all may have heard some of these stories. We've had incredulous success working from a multidisciplinary team, but one that really sticks out to me are 2 mothers, and it was highlighted on the news, in which both had experienced domestic violence from the same partner at different times. The long and short of this story is that the second mother of the child in utero was thrown against a wall in which her pregnant stomach made an imprint, and she videotaped it. We had a YWCA advocate bring the video after the victim reached out to the YWCA to our multidisciplinary team. At that point, law enforcement's involved were working on collaborating with both mothers, because the other mother had a daughter who was now 7 or 8 and was experiencing some really post-traumatic stress disorder syndrome in school and emotionally. We also then had a child that was born and diagnosed with PTSD because of the abuse that had occurred while mom was pregnant. And really for us, I think, had we not worked together, we would have not seen the outcome for justice, one, for our victims, but also what that perpetrator deserved. And I will speak from experience of working within these systems. I worked in children's services a lifetime ago, long ago, working within these systems of victim advocacy. I have never seen a person more dedicated to seeking justice for victims than Scott O'Reilly. I mean, I know Commissioner Painter, you were there when he was presented the award in 2018 by the state of Ohio for the best prosecutor victim advocate. And that just really solidifies why this is so important to have in our community. We're thankful for your support. We look forward to our future collaboration, and we're appreciative of the time that you're giving us today. So thank you, everybody.
That is all we had, unless there were any specific questions that the commissioners had. We appreciate the time and just giving us the opportunity to tell not only the three of you, but really the community at large, what we think is a really groundbreaking opportunity for our community.
Scott, what a wonderful thing that Mercy Clermont has stepped up and provided that office space and minimized the trauma.
Yes.
Absolutely, hats off to them. Thank you for your presentation this morning, and to all the board members. Thank you very much.
Thank you very much.
Thank you, commissioners. Take care.
We're moving on this morning. Is Julian online yet or not?
Yes, she is.
Good morning, Julian. Are you with us?
Yes, I am. Thank you. I apologize for being a few minutes late getting logged on. So just to give kind of a quick update on where we're at, it's been a couple weeks since I've been able to kind of be on and give an update. A few kind of important things that have been occurring. The governor did announce that once the state reaches a case rate of basically 50 cases per 100,000 population over 2 weeks, once we can get under that, the orders would basically go away. So just to kind of give people an idea of where we're at, Clermont County, as of today, is at about 165. So we still got a ways to go to get there. The state as a whole updates that number on Wednesdays, so that'll be updated this afternoon. You can go online to find that. Last week's number was at 179. So that number for us here locally, at the beginning of January, we were up over 1,000 cases per 100,000 over that 2-week time frame that they look at, one of the metrics that we look at. And so we have seen a significant decrease in that. However, what I will say is the last probably week or so, we've started to see the rate at which we were decreasing start to slow down. And we really want to make sure that we can continue on that downward projection so we can kind of get to that, that 50 case rate on it with it. So lots of things going on with vaccination throughout the county. The state currently, so their percentage of number of people that have started vaccines is a little over 17%. We're just under 10% for those that have completed the series. And then for Clermont County, for us, we are at about 15.6%. We have started vaccinations, and when I say we, collectively, all the vaccinators who are providing vaccine to Clermont County residents, not just public health. We've started for 32,231 individuals have started their series, and then 8.66% have completed. That's 17,886 individuals. So previously, I would have reported that as kind of first dose, second dose, but with the launch of the Johnson & Johnson vaccine, which is a single dose series, on it, and it's really just going to be those that have started and completed. So once you get your Johnson & Johnson, you would automatically go to having completed the series because that is a single dose shot. The governor did announce earlier this week that we're opening up to additional vaccine categories. So he opened up category what they're calling 1D, which is any individuals with type 2 diabetes and end-stage renal disease. And then 2B will be 50 plus population. We have been working through our wait list pretty vigorously over the last week or so, and then through the weekend to get individuals scheduled into clinic that were eligible, that were on that list. So at that time, that was the 65 plus. They hadn't announced the 50 plus yet. And so we've really been working through trying to reach out to those individuals. We're finding many of them are getting vaccinated other places, which is fantastic. We want people to get vaccinated as quickly as possible wherever they can. So as we kind of wrap through that, we are going to be transitioning to moving to an online system. We're going to be using Armor, it's called ArmorVax as the system we'll be using, which will allow for online registration of appointments. We will still keep our COVID call center open for those individuals who may have difficulty scheduling or may not have internet access. So more to come on that. We're releasing some information this afternoon that'll allow people to go and download an app onto their phone, and they can register for appointments that way. We are also looking at transitioning locations. Unfortunately, we don't have everything finalized. We're hoping by later this afternoon, we can make the public announcement about that we'll be moving to an offsite location that will actually help us increase our throughput so that we can vaccinate more individuals on a daily basis. So that is all I have, unless you guys have questions for me.
Julianne, just a question. I know that the governor has made that announcement and I believe listed some large vaccination sites. Is there any particular place on his list that is close to Clermont County that if those people that want to go to a large site could get vaccinated pretty easily?
Yeah, so there are some additional sites opening up. They're not all open yet, but he did make announcements. There is going to be a larger open public site at the Wilmington Airport. That site is actually going to, my understanding, is going to be ran by Kroger's. So you would do scheduling through them when they get those facilities up and running, but that will be a large scale site. And then also they're looking at doing a clinic at Centos Center that would also be close for our residents, depending on kind of which direction you would want to go with it. There are still others within the county. Many of our pharmacies are Kroger pharmacies, several of our other pharmacies. Some of our private pharmacies started to come online this week and receive vaccine also. With it. And then, you know, our community health center is still vaccinating. Health Source in Mercy Clermont is also receiving significant amount of vaccine that anyone can kind of go and there's a state website you can kind of go to look at all the vaccine providers and find out, you know, really what works best for you. Many people offer clinic times, dates, you know, Saturdays. We'll be running a Saturday clinic this Saturday to try to allow individuals that might not be able to take off work as we kind of move into those younger you know, populations to allow a little bit more flexibility.
And then just another question. I know, you know, when the vaccination process started, we had talked about statistics about, you know, death rate in Ohio, obviously 65 years and older. And then there'd been a conversation about when the population 65 years and older had actually been vaccinated, we would deem kind of herd immunity, but we always talked about the fact that there might be as many as 50% that would not choose to be vaccinated. Any update on that? What are you seeing as far as the population that wants to be vaccinated versus those who pass?
Yeah, so actually we're seeing, you know, quite a few people in that older population on it. I'd have to go back and pull our numbers, but I think we're well up over around probably 65% of our 85 plus population has been vaccinated. And that doesn't necessarily mean that they've made that ultimate decision. There are some people that are kind of in the wait and see camp. We do encourage them to get vaccinated as soon as they can, but that is a personal decision to make on whether they do it. There's also not a lot of statistics out there yet about what herd immunity is going to look like. So we don't know that that's the 65 plus population. We don't know that that's 50% to be able to make it. And unfortunately, again, as we've said all along, new virus, also new vaccine. We're not sure what it's going to take. And I think the other thing to be very concerned about is some of the variants that are circulating and how well the vaccine is going to protect us against those and how quickly those can spread. And that's just another variable that we can't predict and we just don't have enough information about at this point.
And then are we doing everything that we could to, you know, try to reach out to people to be vaccinated? And I noticed that Dolly Parton, you know, is now, you know, on the Tennessee realm and out there reaching out to people and trying to, encourage people to seek the vaccine. Is there anything else that we could do to help you get people vaccinated?
Yeah, so I mean, I think it's just those continued conversations, making sure we're referring people to kind of reputable sources about vaccine information so that they can take that opportunity to really, educate themselves, not necessarily just going with what's being circulated on social media about different types of things, but really looking at some of those reputable sources for vaccine information and continuing to encourage people to get vaccinated. I think we are doing a pretty good job. There's always going to be more, and I think as more vaccine becomes available, that'll give us some time to do some additional outreach throughout the county and some other areas that maybe aren't as heavily populated with providers, and we're looking at some ways we may be able to do that in the future with it. We actually today are out doing some of our homebound population. So we have individuals that absolutely under no circumstances can make it out of their home. It would require, maybe an ambulance transport or something to get them to a doctor's appointment. So I actually have a nurse who's out and about today who is going out to vaccinate those individuals. While they may not be exposed because they can't leave the home, they are being exposed because they have caregivers and people coming into the home. With it. So, we're trying to do our best to reach those populations. And then again, continuing to keep a call center open for those. We kind of went old school at first with a lot of the manual scheduling. And I think it really helped for some of our elderly population who may not use technology as much as some of the rest of us do. Some of them do. Some of them are really pretty tech savvy on it. When you're calling 90-year-olds and they said, I already got my vaccination because I got a message through my MyChart, and they figured it out with it. But we're really trying to give people multiple ways that they can reach out in order and then provide assistance to them. Since we are implementing this new software, my hope is I've been in communication with the libraries, the public libraries. We're hoping in a few weeks to be able to do once we kind of get our feet underneath ourselves here in the next week or so, to do some training with them so that they will also be able to help individuals register or set up profiles, do whatever they need to do if they choose to use that option. And certainly our libraries will have internet access for them. So we are really trying to do what we can do as far as reaching those out in the community. And I think more to come with it as more vaccine becomes available. And hopefully we continue to have resources. I'm not going to lie, our staffing is still stretched a bit thin, so there's only so much we can do. But we do rely heavily on a lot of our partners in the community, which has been fantastic.
Thank you.
Thank you, Julianne. Moving on to the animal shelter this morning, we have Caleb Peterson, should be with us on Zoom.
Hi, good morning.
Good morning to you.
Nice to be with you guys today. I'll start off. We have a lot of news to share today, but I'll start off with our progress so far. For the month of January and February, we've been slowly opening up the operations that we can provide in-house, slowly expanding the animals that we can bring into the shelter. For January, we were able to pull 12 stray animals from the public, and 2 were turned over for owner surrender. For the month of February, 20 were pulled from the public, 3 were picked up from our wardens for injuries, and 7 were relinquished due to owner surrender. Now, we do not allow at this point anybody to just surrender their pet. We are only accepting animals that it's an emergency situation. So that can be the passing of the owner, financially critical situation, things like that. We're taking it on a case-by-case basis, but we do believe firmly in working with people in our community and making sure that animals in need of care have access to it here. The outtake numbers, animals that were redeemed by their owner in January were 4 and February 13. Transferred to rescue in January were 8 and February 17. And then we have a few dogs left over from the previous administration that have pending court cases. But for the month of January and February, we did have a 100% live release rate. Every dog that came into our shelter left alive and healthy and happy. Moving forward, we do plan on opening to the public on March 16th, which is next Tuesday. Our hours that will be open to the public will be 12 to 4. We are at this time only going to do it by appointment only. All the animals that we'll have in our facility, you'll be able to see on our Facebook. Our website is still under construction, and so you'll be able to call us, schedule an appointment, come see a dog that's available for adoption. And the appointment only will only last while the COVID restrictions are in place right now. We have done multiple renovations to the building, and some of them are ongoing, but we expect them to be completed by the time that we open up to the public. This includes repainting the building, a deep clean. There was a rodent problem when we came on board that's been addressed. We're reconstructing our play yard. We've re-epoxied some of the floors and some of the kennels that were damaged. We'd wanted to make sure the animals in our care were not consuming pieces of that epoxy. Again, all the animals that we have will be available on our Facebook for members of the public that want to see until our website is available. And that's all the information I have. Do you guys have any questions for me?
Just great job, Caleb, to you and everyone who's worked on that facility. It looks fabulous.
Thank you.
Especially getting all the
Very
rodents
excited.
out of there. We're excited about it too. Thank you very much.
Caleb, just one question. When it comes to owner surrenders, what are you doing, or are you trying to help those owners if the issue is dog food or some particular care that they're just not able to provide?
Yes, sir. So we're handling on a case-by-case basis. We have reached out to some of our local rescues for specific breeds that can be taken. If it comes to financial issues of like, well, I just can't afford dog food, then we are sending people home with dog food. Our primary objective is to keep, if the owner is capable and willing and wanting, we want to keep that family unit together. We don't want to split the animal apart. It's only in severe cases that we have accepted the surrender. Some of the most common ones so far have been, I'm due to financial situation, I have to move to a new facility, a new apartment, a new home, and I can't take the animal with me. The previous owner passed away, and a family member is just trying to make arrangements, but we're doing everything in our power to make sure that the people who want to keep their pet are able to keep their pet.
And you have a pit bull in your shelter right now that has received some really top-notch care. And while I was over there this week, I saw that I got to see him go out for a walk on a leash, and he was a giant wiggle. So I just wanted to say thanks, and we appreciate everyone that cared for him, and I'm sure he'll make someone, a great pet.
Well, thank you very much, and we've been all of you guys have come to visit and check on our progress, and of course you guys can continue to be welcome in the future. We appreciate all the support we've got.
Thank you.
Thank you, Caleb. Moving on the agenda this morning, we're now to the consent agenda. Board, you've received the consent agenda in advance for your review. Any corrections or additions? Please put it up for a motion for vote. Do I have a motion to approve the consent agenda?
I'll make the motion.
Is there a second?
Second.
Any further discussion? Hearing none, call the roll, please.
Commissioner Bachelor?
Yes.
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes. Now we move on to item which is E, and that's on page 2, item number 3. It's the recommendation that the Board of the County Commissioners adopt resolution number 036-21, resolving to approve payment to vendors in the revised total amount of $2,432,942.20 as set forth in the BCC approval invoice report for checks dated March 10, 2021, BCC directed prepaid invoice reports, and or the procurement card transaction report as presented by the county auditor on March the 8th, 2021, and further authorizing the county auditor to issue warrants for same pursuant to section 31.16 of the Ohio Revised Code. Do I have a motion to pay the bills?
So moved.
Is there a second?
I'll second.
Any discussion? Hearing none, call the roll, please.
Commissioner Painter?
Yes.
Commissioner Batchelor? Yes. Commissioner Corcoran?
Yes. Item number 4. Mr. Palmer, good morning to you.
Good morning to all the commissioners.
Good morning.
Morning.
Item number 4, Clermont County Sheriff's Office requests to advertise for competitive sealed proposals for a security system upgrade for the Clermont County Jail Adult Detention Facility pursuant to and in compliance with Section 307.862 of the Ohio Revised Code 21-0226-006. The recommendation of Joseph A. Palmer, Jail Administrator, Clermont County Sheriff's Office, with the concurrence of Thomas J. Eigel, County Administrator, to approve the request to advertise for competitive sealed proposals for a security system upgrade for the Clermont County, Ohio Jail Adult Detention Facility, pursuant to the specifications therefore, and to authorize the clerk of the board to place a legal notice in a newspaper of general circulation for 2 consecutive weeks, commencing on Thursday, March 18th, 2021, scheduling a non-mandatory pre-proposal meeting on Monday, March 29th, 2021, at 10 a.m. at the Clermont County Jail, 4700 East Villiger Road, Batavia, Ohio, 45103, with said proposals to be received until 2 p.m. local time on Thursday, April 15th, 2021, in the office of the Board of County Commissioners, 101 East Main Street, Batavia, 45103, where they will be publicly opened and acknowledged thereafter, pursuant to and in compliance with Section 307.862 of the Ohio Revised Code. This notice will also be posted on the Clermont County's website at the following URL link, www.clermontcountyohio.gov.
Board, you've heard the recommendation of Joseph A. Palmer, Jail Administrator for the Clermont County Sheriff's Office, and this is to approve the request to advertise for the competitive sealed proposals for a security system upgrade for the Clermont County Jail Adult Detention Facility, and this is in compliance with Section 307.862 of the Ohio Revised Code. Do I have a motion to approve?
So moved.
Is there a second?
Second.
Is there any discussion?
Yeah, before, what is the budget for this particular project? Is this project already budgeted?
Yeah, it's in the capital plan right now. I think the estimate was about $445,000, if I recall.
Okay. So if the bids are received are within the 10% of the estimate frame, we would proceed with getting this done.
That's correct, sir.
Joe, I understand that the communications system and the actual security system over at the jail is quite old. Is that correct?
Yes, sir. I gave you, on behalf of yourself and your fellow commissioners, a little outline here.
We just got it when we sat
Of
down.
what happened. It is, right now I'm operating on a Band-Aid system. One in our newest area is 20 years old. The other system is 36 years old. And I'm spending thousands of dollars a year just to Band-Aid it. They can't fix it because it's too old to be fixed. In the topic paper, $24,000 alone last year was solely spent on Band-Aids. Those Band-Aids have broke already. Are we able to put it back together? Yes, because one of the things I do not want to go to on a regular basis is keys. And I know you ladies and gentlemen understand that those key issues take away time. And I tried to put down a few things here that are of deep concern with time. We measured things in the jail by seconds, because seconds is what we're talking about with what's involved here. Especially when I have the number of people detoxing in the jail and are suffering from mental health issues. We do our very best to take care of their needs, and I know, Commissioner Painter, you visit on numerous occasions, and know we do try to do the very best we can, but in going to the keys, it takes away from seconds and adds minutes to us getting into a cell where someone needs our help. What if there's a medical emergency? God forbid some inmates are fighting. Or worse, an inmate assault on members of staff. It can be done, but it just takes away from time. And I did try to say the last, time is of the essence. Our system is antiquated, and I'm looking after the security of the inmates. The sheriff is required to do such under 311. I mean, he's required to provide for their safety and security. I'm also looking after our staff. As administrator and representing the sheriff, that's what he's looking after. And I guess it's time. I'm not trying to be presumptuous or snippet when I say it's time. I've got systems that I can't make work, sir. And I'd like to entertain these proposals. I know, as you said, they're proposals. They have to be here by a certain date. They're looked at, examined. We have an evaluation process as part of the RFP, and that doesn't mean it's going to happen tomorrow. It's going to happen in May. It means I just appreciate your courtesy in allowing proposals to be made, sir.
In full well knowing that there are other things at the jail that you may need some type of upgrade or expenditure on, I just call your attention to the governor's proposal in his biennial budget, is that there has been a proposal for dollars to be included for county jail renovation and for new county jails. So something I know you'll be watching closely to see how that comes out.
That was an issue. Mr. Eigel and myself and the sheriff are waiting for grant availability. Mr. Eigel forwarded information to the sheriff, who forwarded it to me. I got back to him on that, and I'm telling you ladies and gentlemen, yes, we will definitely look at grant money. Yes, sir.
Thank you.
You're spending money each year just as a Band-Aid fix, just like if you have a used car, you keep putting money into it, but it's never going to be any better in the long run.
Sure, that's absolutely, yes, ma'am, that's true.
And Mr. Palmer, in your topic paper to us, you explained that in January 2021, that the security automation provided that assessment that this is a serious need. And we appreciate you bringing that to the board. And I'll call for a vote on it now.
Thank you, ma'am.
Thank you. Call the roll, please.
Commissioner Bachelor?
Yes.
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes. Thank you.
Thank you all very, very much. It's sincerely appreciated.
Good seeing you. Item number 5, Phil Pumphrey, Interim Director, Clermont Transportation Connection. Are you with us this morning?
Yes, I am. Can you hear me?
Yes, thank you for joining us.
Thank you. Good morning, Commissioners.
Morning.
I have a recommendation this morning by myself, Phil Pumphrey, Interim Director, Clermont Transportation Connection, with the concurrence of Thomas J. Eigel, County Administrator, to acknowledge the electronic execution and submission of a memorandum of agreement between the Clermont Transportation Connection, the Ohio, Kentucky, Indiana Regional Council of Governments, Butler County Regional Transit Authority, the City of Cincinnati for the Cincinnati Streetcar, Middletown Transit Services, Southwest Ohio Regional Transit Authority, the Warren County Transit Service, and Ohio Department of Transportation, signed by Phil Pumphrey, Interim Director, CTC, by on or about February 16th, to develop, design, and implement standard procedures of operation coordination between the public transportation operators, metropolitan planning organizations, or MPOs, the Ohio Department of Transportation, concerning the performance-based planning process, including coordination on data collection, data analysis, data setting, target setting, reporting of targets and target achievement, data collection for the National Highway System, Asset Management Plan, the Transit Asset Management Plan, and the Public Transportation Agency Safety Plans. And this is an update. It was last signed about 3 years ago. As I understand, it's a change with Cincinnati Streetcar. And you may be familiar with the Transit Asset Management Plan, which is to keep the state of the transit system in good repair, and the Public Transportation Agency Safety Plans, which the FTA requires as well. So we'd like to seek your approval on this, and be willing to take any questions.
Thank you. This is a recommendation, Board, to acknowledge the electronic execution submission of a memorandum of agreement among the Clermont County Transportation Connection and all the other public transportation operators, as was written in this document, to develop, design, and implement standard procedures of operation and coordination between the public transportation operators. Do I have a motion to approve?
I'll make the motion.
Is there a second?
You'll have to second.
I'll second. Is there any discussion? Call the roll, please.
Commissioner Bachelor?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Abstain.
Item number 6. Good morning, Counselor.
Good morning. Good morning.
Good morning.
It is the recommendation to adopt resolution number 037-21, resolving to designate County Commissioner David L. Painter as the representative of the Board of County Commissioners of Clermont County, Ohio, to, number 1, attend the settlement conference that is scheduled in the United States District, Southern District of Ohio, Western Division, in and as it relates to case number 1:19 CV 453, and number 2, authorize County Commissioner David L. Painter as its representative to enter into a settlement agreement on behalf of the Board of County Commissioners of Clermont County, Ohio, wherein United States District Court, Southern District of Ohio, Western Division, case number 1:19 CV 453 is settled such that the relevant litigation will be concluded.
Board, you've heard the recommendation to adopt resolution number 037-21 to designate County Commissioner David L. Painter as the representative of the Board of County Commissioners of Clermont County, Ohio, to attend the settlement conference that is scheduled in the United States District, Southern District of Ohio, Western Division, and as it relates to case number 1:19-CV-453, and to authorize the County Commissioner, David L. Painter, as its representative to enter into a settlement agreement on behalf of the Board of County Commissioners. Do I have, in Clermont County, do I have a motion to approve?
I'll make the motion.
I will second. Is there any further discussion? Hearing none, call the roll, please.
Commissioner Bachelor?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Abstain.
That finishes our non-consent agendas. Or any additions this morning?
Commissioners, please consider adding an additional resolution that would designate a mediation conference representative on behalf of the Board of County Commissioners. And this is pending in the Court of Common Pleas of Clermont County.
Do I have a motion to add this item resolution number 038-21 to the agenda?
I'll make the motion.
I will second that. Any further discussion? Call the roll, please.
Commissioner Bachelor?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes. Counselor, good morning.
Morning. This is a recommendation, excuse me, to adopt resolution number 038
Oh, hold on just a
Hold on
second.
moment. I think we need to do the vote again, please.
Right, this was just adding it to the agenda, is that correct?
Yes.
You
Okay.
abstain, right?
Abstain.
Okay, we're going to vote again. Do I have a motion to approve?
I'll make the motion.
I will second.
Commissioner Bachelor?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Abstain.
Thank you.
Sorry, Counselor.
That's all right. This is a recommendation to adopt resolution number 038-21, resolving to designate County Commissioner David L. Painter as the representative of the Board of County Commissioners of Clermont County, Ohio, to number 1, attend the settlement conference that's scheduled in the Court of Common Pleas for Clermont County, Ohio, as it relates to consolidated case numbers 2020 CVC 1011 and 2019 CVC 1479. And number 2, authorize County Commissioner David L. Painter as its representative to enter into a settlement agreement on behalf of the Board of County Commissioners of Clermont County, Ohio, wherein Clermont County Court of Common Pleas consolidated case numbers 2020 CVC 1011 and 2019 CVC 1479 are settled such that the relevant litigation will be concluded.
Board, you've heard the recommendation to adopt resolution number 038-21 Resolving to designate County Commissioner David L. Painter as the representative of the Board of County Commissioners of Clermont County, Ohio. Number 1, to attend the settlement conference that's scheduled in the Court of Common Pleas for Clermont County, Ohio, as it relates to consolidated case numbers 2020 CVC 1011 and 2019 CVC 1479, and 2, to authorize County Commissioner David L. Painter as its representative to enter into a settlement agreement on behalf of the Board of Clermont County Commissioners of Clermont County, Ohio. And the consolidated cases would be case numbers 2020 CVC 1011 and 2019 CVC 1479 are settled such that the relevant litigation would be concluded. Do I have a motion to approve?
I'll make the motion.
I will second. Any discussion? Call the roll, please.
Commissioner Batchelor?
Yes.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Abstain.
Thank you, Mr. Ramus. Moving on to item number G, any other additions before we move to executive session? Okay. Moving to item G, executive session pursuant to section 121.22 G1 of the Ohio Revised Code to consider the employment, dismissal, discipline, or compensation of one or more public employees. Do I have a motion to enter into executive session?
So moved.
Is there a second?
I will second.
Any discussion? Hearing none, call the roll, please.
Commissioner Painter?
Yes.
Commissioner Batchelor?
Yes.
Commissioner Corcoran?
Yes. We are now going into executive session. We will return shortly. We return from executive session, and at this point, is there any county staff, elected officials discussions this morning?
No, ma'am.
Hearing none, we'll move to item I, member comments. Members, any comments this morning?
I think one of the things we learned today is that we are on the downhill side of COVID-19. However, we are all very, very anxious to get back to our normal lives. And basically what Julianne, just to kind of paraphrase that, said was that we're just not there yet. You know, she gave some statistics there as far as what the actual statistic was. What we're looking to get down to was, 50 over 100,000 for 2 weeks in a row. And this week we're currently at 165 over 100,000. So we've got a ways to go, but she had also mentioned that it seems to be flattening out, that we had went from 165 last week, 179 last week to 165 this week, but it isn't expected to have such a rapid as a drop. So, continue to protect yourself. It's not impossible to get COVID-19. I can tell you that pretty easily. And, keep yourself safe, still safeguard. What the proper PPE is to use. We're all adults. We can choose what our risks are, and that's the freedom that we experience here in America and Clermont County. But be safe and continue.
And I will say, David, her staff has done such a fantastic job, from working up at the call center and myself going up there and getting the COVID vaccination. I even had a person come up to me and tell me that they called the call center and how impressed they were that they were able to get all of their questions answered on that phone call. So hats off to her and her staff for the job well done.
Very nice, very nice.
Vaccination is, another great way to combat, the COVID challenge. And I think, what was the last call this week? Are we down to 50? 50-year-olds or 60-year-olds? 50. So we're down to 50. In a couple weeks, it'll drop down to my age. And,
Brother.
Another few weeks, yeah.
Okay.
We'll get there eventually.
At this time, I will entertain a motion to adjourn. Do I have that motion?
Make that motion.
Is there a second?
Second.
Call the roll, please.
Commissioner Batchelor?
Yes.
Commissioner Painter?
Yes.
Commissioner Corcoran?
Yes, we thank you for joining us today, and be safe, everyone. Thank you.